to get clean. You don't see as much tissue, but it's still bleeding. It's bleeding. Check for a pulp horn. Sometimes you'll have a little piece of tissue up in a pulp horn and you just don't know where the blood is coming from, but it's a little pulp horn that has to be unroofed. So that's another area that can be frustrating. Ultimately, using paper points have a tamponade effect as well. So you can use that to help start clotting. But basically you want to move forward with debridement. And once the tissue comes out, typically it's going to stop bleeding. Now, if the patient is on blood thinners, if the patient may be an alcoholic, you may have some other issues with bleeding that could be coming from the apex. If you over-instrument, you could get bleeding from the apex. So what I'm trying to do is just give you this sort of realm of possibility of what could be causing that bleeding. Sometimes it doesn't stop and you have to put something like calcium hydroxide in there. But most of the time, once you've cleared the tissue out and you get some sodium hypochlorite in there, it should settle down.